Good morning, everybody. Dr. Patmos here. It is March the 27th. And yesterday, Robert Kennedy and Dr. Mehmet Oz, who is the director of the Centers for Medicare and Medicaid Services, made a huge announcement. They have formulated a new committee of, I think, 18 people culled from over 400 nominations to advise the federal government on how to improve healthcare. And they announced this with great fanfare and made the promise that this committee will, which is a non compensated committee, has volunteered to share their knowledge and expertise and advise how the healthcare system can be made more effective and efficient for the benefit of everyone, the patients especially, and also the federal government. Well, I took a look at who is on this committee, and you can see the list below with an analysis of who they are and what their backgrounds are and where they have come from. First of all, let me say this list is a vast improvement over the kind of people that Kennedy has been appointing up until now. The committees that he's been appointing, the individuals he's been appointing, were totally unqualified, with some with bogus credentials and really fringe, uh, almost wacky, people completely out of the mainstream of healthcare and science. People who advocate things like full moon healing ceremonies and stuff like that. Anyhow, this committee is a big improvement. If you look at the people who are on this committee, they are all legitimate healthcare leaders. The committee really is formulated and structured in a very interesting way. Is largely composed of non-clinical healthcare health system executive leadership, chief operating officer, chief executive officer, folks from large health systems like Essentia and Sanford Health. It also has a very heavy on the legal side. It's got, I think, 7 lawyers on the committee. And then there are a smattering of other folks, including people from large physician employment model organizations like Village MD. The CEO of Village MD is involved there, and that's a very large physician practice. And there's also a very heavy element of data and analytics perspective on this committee, and people who are really geared toward and oriented toward value-based healthcare purchasing. Now, I know a little bit about this. I used to be CEO of a large multi-specialty in a clinically integrated physician organization with hundreds of physicians. So I do have some perspective on this. This committee is a very big improvement over what the kind of people that Kennedy was appointing before. If you look at the kind of people he put on the CDC ACIP, they're completely unqualified. As the court determined, they're, I think the quote is, the judge said, distinctly unqualified. This is a big improvement. These people that he appointed are very qualified. There's some really excellent people on this group, but there's still something missing. What perspectives are not represented on this committee? There are several, and they are key perspectives. And had they been included in the configuration of this committee, it would be a much stronger committee. And the perspectives that are missing are physician perspectives, practicing physician perspectives with representation from physician organizations like the American College of Physicians or the American College of Surgeons or any of the medical societies, specialty societies that represent physicians. There's no representation from nursing organizations. I mean, the nurses are at the bedside caring for our patients day in and day out. They're the first responders, if you will, of healthcare, and there's no representation from nursing organizations at all. There's no representation from public health organizations, from research organizations, or from medical education other than graduate medical education. I do commend Kennedy for appointing someone from the GME world. That's fantastic. Residency training is crucial, as we know, to being a fully trained physician. And at least Kennedy is acknowledging that people need to have internships and residencies, unlike the people he's appointed in the past who didn't seem to understand that internships and residencies were important. Um, so that's an improvement. But what's also missing is any representation from the payer community and the purchaser community. After all, the people who pay for healthcare, employers, should be represented in any health system reform effort, and the purchasers, the fiscal intermediaries who do the buying of healthcare for these employers, should also be included in the room. And then finally, there's no patient level representation. There's no representation from any organization that represents healthcare consumers. So I think that this committee is a good start. It's certainly an improvement over what uh, Kennedy has done in the past, and I think probably Dr. Oz has something to do with that. He went through a more thoughtful process of actually vetting nominations rather than just appointing people that wrote anti-vax articles. So this is a step in the right direction for Robert Kennedy, but it's still not optimal. There still needs to be other perspectives, and I'm sure that the list of perspectives that I've identified as missing is not complete. There are probably other perspectives that need to be included as well. Um, so I hope maybe this is the beginning of a better committee that will include additional voices in the future. Uh, Finally, if you look at the composition of this committee, you got healthcare CEOs from integrated delivery systems, healthcare CEO from a large employed uh, multi-state physician group, people from value-based care, data analytics, and lawyers. You can kind of predict the direction that this committee is going to go. They're probably going to end up recommending further development in the number and scale and size of clinically integrated healthcare delivery systems with a tripartite model of a hospital, aligned hospitals, employed medical groups, and a in a value-based purchasing arrangement in a payer model. That's probably the direction this committee is going to go. This is what they do in their roles from the organizations they come from, and I suspect they will promote that which they know, which is the clinically integrated healthcare delivery system based on aligned hospitals, employed physicians and providers in a value-based care arrangement, um, with taking risk. They could have just asked Kaiser Permanente, who did this all 50 years ago and saved everybody the trouble.